Okay. So, what brought you to the doctor today? Okay, let's start over.
Okay.
Okay. Hi, my name's Robin. I'm going to be your nurse today.
Hi, Robin. I'm Sherry.
What brought you to the doctor today?
I just wasn't feeling as good. I was out and about with the kids doing some walking and, was having some mild chest pains and, was just feeling
That's
real
not
tight in my
good.
chest. Yeah.
So what brought on the chest pain? When you were walking?
Yeah. It's just like whenever I'm doing stuff where I'm having to be physical and be active that I'm noticing the pain.
Okay. Have you had any respiratory problems lately with that, or like a cold or bronchitis or asthma, anything like that?
I had a little upper respiratory infection about a week ago.
Okay. Did that make it worse, or is this all the time that you get this?
Well, I have been noticing the chest pain about a month or so prior to me having the upper respiratory infection.
Okay.
Yeah.
How long does it usually last?
It usually lasts about 10 to 15 minutes, and I usually sit down, it kind of relaxes, and then it kind of goes away.
Okay. Now, have you noticed that there's anything that brings it on besides the exercise or stress or?
No, just when I'm walking and moving around with the kids.
Okay. So do you get any visual changes with that, or a headache or anything? No. Just the chest pain.
Mm-hmm.
And where does the chest pain? Where do you feel it at on your chest?
It's more up here, upper.
And it's both kind of equal on each side?
Mm-hmm.
Okay. Do you exercise at all on a regular basis?
No.
Okay. So it's just when you're out there playing with your kids? It's kid-induced. I had that same problem. Okay. I'm going to find my stethoscope and listen to you real quick. I'm sorry, that was not being prepared. I'm going to listen to your chest.
Okay.
And right now I want to, I'm looking at I want to evaluate your pulses and stuff right now. Your skin appears nice and warm. You don't get, you don't feel clammy. It's nice and warm and equal. I'm going to feel for I feel pulses. I don't feel any lymph nodes down here underneath your jaw. I want to feel for your pulses up here in your temples. They feel equal, nice and strong, 2+. All right. Can you turn your head to the right? And I'm going to feel here. I'm going to feel for your carotid down here at the base. Okay, turn your head to the left. Good, nice and equal. All right, I don't notice that you've got any jugular vein distension right now. But I can feel that right there. Okay. I want to feel for your pulses down here in your arms. These are your brachial pulses. Okay, nice and even. Your radial. Okay, down here in your wrists. Nice and even. Okay. You got finger rub polish on, so I'm going to check down here with your in-between and see what your capillary refill is. It looks like it's less than 2 seconds. Your fingertips are nice and warm. Yeah. No misshapen things, so it doesn't look like you've got any ongoing respiratory problems. I need to feel, if you were actually lying down, it would be optimal, but I would feel down here in your groin area for temporal pulses, or not your temporal pulses, your femoral pulses, and those feel nice and strong. I'm going to check back here in the back of your knees for a popliteal pulse, and those are equal and bounding. I'm going to check here on top of her dorsalis pedis, and those are equal, and posterior tibial. Good. I don't note any edema, some trace edema back here by her malleolus. Her feet are nice and warm, and her capillary refill is equal to. All right. So your pulses look nice and normal. All right, now I'm going to listen to your chest real quick. Okay. Just breathe normally. Okay, I'm listening here, S1, and this is her aortic valve, pulmonic valve, pardon me, and this is her second intercostal space, mid-sternal border. Going to move down here into the third intercostal space, excuse me, and that's Erb's point. Okay, fourth intercostal space is her tricuspid. Good. And can you lift up your breast for me real quick? Okay. The fifth intercostal space, mid-sternal, or mid-clavicular, right down here, would be her point of maximum intensity, which I'm able to palpate that as well. That's the closest in the fifth intercostal space. And this is the mitral valve. Okay, and now I'm going to listen for an apical pulse for a full minute. Good. Rate rhythm is equal.
Good evening. The library is
Strider.
closing in 30 minutes at 5 o'clock. If you would like assistance completing tasks,
Okay.
staff
I don't
members
hear
will be
any
happy to
murmur at
help.
all present.
If you need to contact someone to pick you up, you may use the phone
I
at
would,
the refrigeration
her
desk.
blood pressures have been evaluated on both sides with her right arm and her left arm. I would make sure that I'm noting that she used a larger cuff, make sure that there's no difference. And when I evaluated prior to her interview with me, I looked at those, and there was a difference of less than 10 millimeters of mercury in both arms. So that's all normal. She appears to be in normal health. I will check her EKG and make sure that there's no additional stress. I think that it's probably stress related and maybe possibly respiratory, and would give her a community referral for maybe an exercise class that she would be able to participate in with her children to help her increase her physical conditioning, and then we reevaluate her labs for cholesterol and diet and so forth. Do you have any other questions for me?
No, ma'am.
Okay. So how does that plan sound?
Sounds good.
Find out things that you can do with your kids, and see about trying to get that all incorporated in your lifestyle, and it's something fun for you and your kids both to do. It gets you in shape and it keeps them busy and up and moving around too.
Yep.
Burns off everybody's stress.
All right. Sounds
All
good.
right.
Thank you.
Thank you.